We all sitting on the committee have reserved time to be briefed for tomorrow's hearing later this afternoon. So I'm going to shoot for about 4:15 at the latest. I hope you all work with me to get to that end. We certainly encourage full participation from the committee, and no question should go unasked or any comment withheld. And at the same time, less is more. All of these issues have been heard in subcommittee, and on that subject, I want to very sincerely thank all of our subcommittee chairs and subcommittee members for the many and long hours that you put into those hearings, allowing the public to have an opportunity to participate in this process. And I know it's not been easy because this is anything but an easy year. So thank you for your hard work. We are going to take the agenda as it has been shared with you in the order of Medi-Cal Healthy Families, Resources, Transportation, and General Government. So those will be the issue areas we'll be covering today. And, of course, before we do anything else, we're going to establish our quorum. So if you could call the roll, please.
Leno.
Here.
Huff.
Here.
Alquist. Here. Anderson. Desaulniers.
Here.
Emerson. Evans. Fuller.
Here.
Hancock.
Here.
LaMalfa. Liu.
Here.
Lowenthal.
Here.
Rubio.
Here.
Simidian. Wolk.
Here.
Wright.
Here.
Thank you. We do have our quorum established. So as we begin, just to place things in perspective, as our legislative analyst office had projected just a couple years ago for our general fund revenue to be at $125 billion for 11-12, we are now at $85 billion. So a full third of our general fund revenue, $40 billion, as projected, is just evaporated as a result of this international fiscal crisis. Our challenge in these next few days is to make some very difficult, painful decisions to align our expenditures with that now significantly reduced revenue. So we'll be going through all of the different proposals that the governor has put forward with regard to expenditure reductions, as well as his proposal for revenue to match those reductions, and that's where we begin today. So our first item on page 1, Department of Health Care Services. Mr. Douglas. Always good to see you.
Good to see you, too. Mr. Chair, members of the committee, Toby Douglas, Director of Department of Health Care Services. The first item on the agenda is a 10% provider payment reduction. The administration is proposing to reduce all Medi-Cal provider types with limited exceptions by 10%. This would be a reduction at the final payment. It includes pharmacy, physicians, with some exceptions such as our contract hospitals would be exempt, federally qualified health centers, our breast and cervical cancer treatment program. Non-contract hospitals are included, including all non-contract hospitals except for critical access hospitals. I'm going to go with the less is more and open it up for questions on that.
Okay. Elio, anything to add to this? All right. Colleagues, clearly not an easy vote to take. It's scored at $537 million of savings to, again, place this in some context. Medi-Cal payments to physicians as a percentage of Medicare payments to physicians in 2008, California was at 47%. The U.S. average was 65%. Texas is at 63. Mississippi is at 82. And Alaska is at 140. So clearly this is not an easy decision to be making, but I think it reflects the severity of our situation. Any comments or questions from the committee?
I'll move the governor's reductions.
So would I. Very good. Is that any objection? So what is our count today? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 to 0. Okay. Can I count? 1, 2, 3, 4, 5, 6, 13. And are we missing yet another member? Should we keep rolls open for... Okay, so we'll keep rolls open? Is it just Senator Smidian?
Emerson and Lamalfa.
And Emerson, and we know they're here in Cummings?
Yeah.
Anderson's out. Anderson and Lamalfa.
Okay, we'll keep the roll open. Page 2 has to do with the reduction in intermediate care facilities for the developmentally disabled.
In previous budgets when the previous administration had enacted the 10% provider payment reduction, there were a few exceptions, including our intermediate care facilities for the developmentally disabled. In this budget, there are no exceptions, and this separate proposal includes them for a 10% provider payment reduction for ICFDDs.
This was an inadvertent oversight?
It was.
The intent was to have them consistent?
Exactly, to have no exceptions here.
Right, okay. Questions, comments? Motion to accept?
I move it.
Thank you, and without objection? Medi-Cal provider payment reduction for nursing home level B.
Similar to our intermediate care facilities, previously our freestanding nursing facilities that were funded under AB 1629 were exempt from the 10% provider payment reduction. We are proposing to reduce their payments by 10%. They will still receive a 2.4% increase that was enacted in last year's budget, and then after that, their rates will be reduced by 10%.
And this is for a $172 million savings.
That's correct.
All right. Committee members?
Move the reduction.
Thank you. Without objection. Page 4 is additional general fund savings in your department.
Yeah, along working with your staff, the department was able to identify some additional general fund savings from special funds that had not been used in the previous budget years because of the enhanced FMAP we received under the American Recovery and Reinvestment Act. There was additional general fund reserved, and plus there were intergovernmental transfer money from years past that had continued to remain in a special fund. The proposal here would be to take this money and use it towards our budget deficit. We would need budget bill language to move this, and if this action is taken, we'd request it also include budget bill language.
So noted. Congratulations. Bravo. We would encourage more of the same. $77.9 million. That's terrific. And we have a question from Senator Huff and anyone else? And Senator Rubio.
So I applaud the identification of additional reductions. Question is, are we as a committee going to be applying this to the other cuts, or are we going to be applying it to a reduction in taxes to the voters?
To be continued. I'll take that as a rhetorical question. Senator Rubio.
Well, it's not really rhetorical.
Thank you very much, Mr. Chairman. I am familiar with some counties in the state that still provide safety net provider hospitals, county-run facilities that participate often in the intergovernmental transfer, which this was in a pot of money, and I applaud your efforts. I don't want to be someone who reigns or hells as of today on the bearer of good news. However, I must ask the question, those counties are rolling over significant amounts of debt where the state has not reimbursed the county for services that were delivered to either Medi-Cal patients or medically indigent. So are these dollars those within the intergovernmental transfer that was supposed to backfill or ultimately pay reimburse those county facilities within this payment structure for Medi-Cal? Or is this in addition to and above, and is that money still on its way to county facilities?
We believe this is in addition to, it was money that was, no one can truly account for, that no hospital can come forward and say that it was their money. We are working with, for example, with Kern. We continue to do intergovernmental transfers every year. We have about $10 million going through the health plan that will increase the capitated payments and then goes back to the hospital, both through HealthNet as well as the Kern health plan. In addition, they are receiving IGTs through the disproportionate share program, so this will not impact the money that goes back to Kern. And then we have a lot of money coming from our new waiver. So our public hospitals, we hope, are going to be receiving a lot of money through the waiver as well as our
Specifically Kern?
Every county, but Kern is doing very well, too.
I have an obligation. Thank you very much, though. I appreciate it. And I'll move on this item if it's
Okay,
needed.
very good. Before we take that vote, Senator Huff, I hardly meant to be anything but respectful of your question. A more appropriate answer would be that this will be considered when we get to our conversation with regard to revenue, because what we'll need to be deciding at that point is, do we want to continue to dig California into the bottom of 50 states in Medi-Cal payment reimbursements? Do we want to eliminate $30 million from state library? Do we want to eliminate $10 million more and zero out the Williamson Act? Or might we use some of this monies that we find to sustain some of the infrastructure in the state? That will be the conversation we'll have to have, but we don't have to make that decision today.
Yeah, here's the problem we're struggling with from a Republican perspective. You know, the governor said he's characterized this as half cuts, half revenues budget. We've already identified $8 billion in cuts, $14 billion in revenues, and another $6.5 billion in fund shifts. And this appears to be setting up for another fund shift that's probably not going to be going to getting that more in balance according to what has been stated and equal. And so I'm going to recommend our guys, without having clarity on that we lay off of these votes at this time, because we believe that it should be going more toward that equal cuts versus taxes rather than, going on the other end of the equation right now.
And who knows, we may get there, but that's
I hope we do.
But that's not today's agenda. All right, very good. So we do have a motion to accept the decision of the subcommittee, and we have Republicans abstaining. Is that what I hear?
They're all abstaining.
So that would be 10-0. All right. Mr. Douglas, none of this conversation should in any way discourage you from finding more money. So on page 5, this is the proposal to place a hard cap of 10 visits for physicians and clinics. Proceed.
Under federal rules in the Medicaid program, states have the ability to create utilization controls over the various benefits, and this includes providing hard caps on certain services. In some states, they have hard caps on prescription drugs. They have hard caps on the number of inpatient visits. What we're proposing here is to cap the number of physician visits, whether it's in a physician's office or in a federally qualified health center, at 10 visits per year. The reason 10 visits was derived is based on a calculation of serving 90% of the population. That 90% of the population would not be impacted by this hard cap. And there was a federal Third Circuit decision that covering 90% of a Medicaid population was sufficient to cover the need of the Medicaid population. So that's what we're proposing, and all the hard caps we'll discuss are at that 90% level. There are going to be impacts, and I don't want to state that 90% doesn't mean that the other 10% are not needy. They are the highest need population with very complex chronic conditions, and this is really based on, as you've articulated, the dire fiscal situation we're facing and the very few choices we have in our Medi-Cal program.
Thank you, Mr. Douglas. I'm happy to hear from colleagues, not to be hyperbolic about this, but if we were to accept this, I think the question is raised, does this action make us a death panel? Because this is one of the toughest ones. Any thoughts, comments?
Move to reject the proposal.
The motion is to reject this proposal. Is that unanimous or not? Unanimous decision. Without objection. Okay. And this would have mandatory co-pays.
Currently, under the Medi-Cal program, the Medi-Cal has $1 co-payments for most services, including physicians and pharmacy, $5 co-pay for non-emergency emergency room visits. And those are all voluntary co-payments that if a beneficiary is unable to pay, they still receive the services. We're proposing here to have $5 mandatory co-payments for physician and clinic visits. They would be mandatory, meaning that if the patient beneficiary was unable to pay, the physician would be able to turn the beneficiary patient away from the visit, would not have to provide the services. The co-payment would be charged on all populations, not just adults but children. There would be no exemptions. So this would require a waiver of federal rules under an 1115 waiver, both because of the size of the co-payment as well as the populations covered and because it would be mandatory.
Very good. And the status quo is that there is a voluntary $1 copay?
That is correct.
Committee members?
I'd move approval.
All right. We will accept the decision of the subcommittee without objection, with placeholder trailer bill language to achieve those savings. And then we have another hard cap, this being 6 prescription outpatient drugs.
Right now, the Medi-Cal program has what's called a soft cap of 6 prescriptions per month, meaning after 6 prescriptions, we do prior authorization. A pharmacy would have to submit in a request to provide the additional prescriptions. We're proposing here to turn it from a soft cap to a hard cap, meaning there would be no more prescriptions provided after 6. There would be exceptions, unlike under the physician cap, for life-saving drugs, including for AIDS, drugs for any mental health-related drugs are some of the examples.
And that life-saving decision would be in your department's hands?
It would be in the department as well as in the physician and pharmacy explaining the situation. That they would be the ones at the front line understanding what's going on, and based on the guidance that we would be providing in terms of laying out what would fit under those conditions, it would be a department decision.
I think I would want to spare you that horror of having to make those decisions. Any questions, comments?
Mr. Chairman, would be delighted to do that and reject the proposal.
So the motion is to reject.
And we wish we could do more of this.
And
Well, we're okay on this one. Right. What was the recommendation?
reject.
Oh, yeah, we're against that.
All right. So that would be without objection.
No.
Oh,
We support the
you sustain this. You sustain this. Okay. So then it's 10-5?
Now, is that a previous one? Back on the previous one, was that the same way? Because we supported the governor's proposal on 4260 as well. That was my misunderstanding.
Okay. Sorry for the confusion. So on the 10. All right, so this is a 10-5 vote and 10-4. Thank you for correcting me, 10-4. And then, committee members, on page 5, there was a misunderstanding with the Republican member's position on page 5, the desire to accept the cut. So without objection from the committee, we'll change that total from unanimous to 10-4. 10-3, I'm sorry. Okay. While we're at it, do we want to ask Senator Emerson to catch up on the very few that he missed, so we can bring those up and get those out of the way? Okay. All right. Page 8, mandatory copays for pharmacy.
Okay. Similar to physician and clinic visits, the department is proposing mandatory copayments on pharmacy for all populations. The one difference here is that the copayments will be tiered. They would be $3 for drugs that are on what's called our preferred drug list, where we receive better rebates or lower costs for the drugs, and $5 for non-preferred drugs. Otherwise, it would be the same, require a waiver, and be on all populations and be mandatory.
So again, proposal that's going to cause significant hardship. I think the saving grace of this proposal is that the estimate is that it would shift about 25% from the brand to the generic, given that there's the incentive with the lower copay for the generic.
That's correct, to drugs that will be on our preferred drug list. Yep.
Very good.
Mr. Chairman, I'd move accepting the recommendation with placeholder language.
Very good. And that's without objection. We'll accept the subcommittee's recommendation. Page 9 is a mandatory copay for hospital services.
There are a couple components to this proposal. First, we are proposing to have mandatory copayments of $100 per day for inpatient services, up to a maximum of $200 for the inpatient stay. Those, again, would be mandatory. They would be for all populations. Most likely, these would be collected, unlike physician visits or pharmacy, collected after the visit, given most stays in a hospital are based on an emergency and then result in an inpatient stay, so those would be collected afterwards. The other piece of this is a $50 mandatory copay for all emergency room visits. Right now, we have a $5 voluntary. It would go up to $50, and it would be mandatory, most likely collected again after the visit.
And again, as with all of these, federal waiver is necessary.
That's correct. A federal 1115 waiver would be.
Mr. Chairman, as much as it pains me to do it, I'd move the recommendation with placeholder language.
Breathtaking actions that we are taking. Is that without objection? Yes, Senator Wright.
I'm looking at on page 9 when it refers to the Emergency Medical Treatment Active Labor Act. If there's a issue of liability here, or does the hospital, if the hospital complies with what we just did, and they end up getting sued, are we providing any immunity to a hospital that may end up rejecting a patient, end up in a lawsuit because they complied with what we said, and then they get sued? Are we giving them any liability immunity in that regard? Clearly, the two we can't waive because those are federal laws, but this could end up where there's a case where someone says it wasn't quite an emergency, but they left and came back. My concern is that it's not quite as simple as it's presented here on page 9.
Mr. Douglas, you have a comment on that?
Well, what I can say is that this is a very common practice for most payers to have copayments and higher copayments for non-emergency services. Hospitals are aware of it. They're aware of they do have to do a screening, and this is why it would be collected afterwards. You can't turn someone away without doing the screening first to know if they're at an emergency level or non-emergency, so they would be going through that. And then
and the screening would be fully reimbursable then?
Under our proposal, they would still be the $50 copay, but they would.
Okay, so then,
Senator Wright, I think.
Go ahead. I'm sorry.
Possibly to clarify what in effect happens with this is that hospitals would not want to put themselves at risk. They would, in the case of a patient not having the wherewithal to make the copay, this then translates into a rate reduction for the hospital.
Okay.
That's how it might end up working.
That's, all right, got it.
Yeah. Page 10, mandatory copays for dental services.
We are also proposing for our dental services, primarily now for children. There are a few adult services continue to be provided for federally required adult services, requiring a $5 mandatory copayment on all populations. And the original budget assumed a lower general fund savings, and it was corrected.
Don't tell Senator.
You wanted more money, so.
But don't tell him. Go ahead, sorry. You didn't hear any of that. It's okay. So there was a correction of another $7,900,000 of savings.
That's correct.
Yes, okay. That's what you didn't hear. Yeah.
I see it.
All right. And again, this is for all Medi-Cal enrollees without exception?
That's correct, all enrollees. And primarily, this is going to impact children.
Yeah.
Mr. Chairman, our recommendation is to pass it with and note the correction
Very good. And with
and placeholder language.
placeholder language and without objection. Do we have a new count now? Yes.
Yeah, we got one more.
14. Very good. All right. Page 11 is an elimination of over-the-counter cough and cold medicine.
In last year's budget, the legislature and the previous administration enacted changes to over-the-counter drugs, eliminating certain over-the-counter drug. This budget proposes to expand it to all cough and cold medicine for adults. Children wouldn't be impacted, result in an additional $2.2 million general fund savings. This means it doesn't mean they can't receive prescription drugs, but anything over the counter such as NyQuil, Robitussin would not be available under the Medi-Cal program.
As we prepare to take this action and many others, do we know, are we leading the nation? Have any other states done this? Do we know if any other states are considering these kinds of cuts?
In this, I can't speak to this specific reduction, but I can tell you that states across the nation are grappling with terrible budget deficits, and my Medicaid colleagues running other states are having to propose very similar reductions. It's a terrible time, terrible proposals that are going on in all states. Even, some states are looking to get waivers of the eligibility rules. Other states are proposing to eliminate all optional benefits or take down payments. So it's a very similar story and a terrible story across the nation.
Right. Okay. Thank you.
Mr. Chairman, our recommendation again, painfully, is to accept the recommendation with placeholder language.
Thank you, Senator, and without objection. Page 12 is to limit enteral nutrition products for adults.
Under this proposal, we are proposing to align with the Medicare standard of medical necessity for enteral nutrition products, where it would only be allowed and reimbursed under the program for those who need it because they're being tube fed. Anyone who is receiving it orally would no longer meet the medical necessity standard, and it would not be available. Again, it aligns with Medicare. There will be impacts. Just because you can receive it orally doesn't mean that there won't be pain having non-enteral nutrition supplements. But given our dire straits, we're aligning with Medicare. Many other states have this similar policy. So there will be impacts, but given the situation, this is our proposal.
And do you have any sense of what the daily cost of the enteral nutrition products might be for those who are using them non-tube fed?
I'm sorry, could you say the question?
What the daily cost might be?
I do not know. I mean, we could get you that, but I don't have it off the top, what the average cost is.
And again, this is for those who are Medi-Cal qualified. So
they're Medi-Cal qualified under our current rules. It's medically necessary they're receiving it, so we'd be tightening the rules.
And you did state also that this would make us consistent with the federal government.
On Medicare, that's right.
Yeah. Okay.
Mr. Chairman, the committee's recommendation is to move the proposal with placeholder language.
Thank you, Senator. Without objection. So, colleagues, we're on page 13 now, which establishes maximum annual dollar limits for durable medical equipment.
Under the Medicaid program, there are certain benefits that are optional for states to elect to provide. The next three items we're going to talk about are optional benefits, and again, and I say this every time, they're only optional under from the Medicaid perspective of whether we provide it or not. For beneficiaries, these are necessary and essential benefits. Instead of eliminating these optional benefits, what the administration proposed to do is to change the utilization controls and set caps on the amount of expenditures that can be consumed by an individual beneficiary under each of the benefits. And we set it again at this 90% threshold that it would cover 90% of the beneficiaries would not be impacted. So if we are establishing a cap under durable medical equipment for $1,604 annually that a beneficiary could consume for durable medical assistance, medical equipment, and this would not impact children. This would only be for adults.
So our notes show that 10% of those needing these types of products exceeding the limit have an average cost of about $4,600 annually, and we're setting the maximum at $1,600.
That's correct. These are, and the data, and I'm sure Ms. Van Meeren shared some of the data. It's primarily electric wheelchairs. These are expensive items that are helping individuals remain in their homes, and under this new rule, they wouldn't be able to receive those types of wheelchairs.
Just to clarify the discussion a little bit. So we're talking about a less expensive wheelchair than a more expensive wheelchair, but in the case of someone with cerebral palsy, for example, who can't sit upright in a less expensive wheelchair, they'd have to come up with that thousands of dollars of difference or just find themselves out of luck. Yeah,
that's right.
Mr. Chairman, it's a great pleasure. I move to reject this proposal.
The proposal is to reject the savings and the proposal of the governor to sustain the decision of the subcommittee.
We support the governor's position, so we reject this. We do have some concerns just on procedure, just because if all we're doing is, if we're not willing, we as a committee not willing to do the cuts the governor's done, we're shifting other funds. At some point, we're kicking the can down the road because those shifts aren't going to take care of the structural problem. You're creating it bigger here. I'm sure you have a rabbit in the hat somewhere you're going to pop out, and we're probably not going to like that solution either. But I'm just saying, the farther we stray from the path the governor has done creates yet more of a challenge for those of us on this side of the aisle to meet you where you need us to be.
So I'm going to take that as a question.
Take it however you wish.
So just to reiterate and clarify, both for purposes of the committee as well as for those who are with us today, our goal, and mine as chair, is to meet the governor's targeted number and to work within his broader architecture of the budget. So yes, where we are rejecting some of the most untenable, most cruel-hearted proposals in our desperate situation, our intent is to find other dollars to buy out those rejections. So we're going to keep focused on the governor's number. We may be off a penny here or there, but we're going to be very close to that number. And this is all on one side of the equation, that on the revenue side of the equation, we will, as I mentioned, have suggestions as to how we pay for these, but also, of course, as the governor has proposed, the thought is to let Californians, not just this panel and not just those of us who have the privilege of being on the floor of our legislative houses, to have their response to the kinds of actions we're taking today, because though the proposal for the June revenue would not in any way restore those cuts that we're making today, without a doubt, it would make this an even meaner state. And so that's part of our solution as well, is to propose to California voters to have a chance to review what we've done and to see which direction they want to go in, even deeper cuts, or to at least sustain the situation and not make it any worse.
Well, if I could just say, to the degree that you intend to match the governor's numbers with fund shifts, we're doing what he said he didn't want to do, and that's kicking the can down the road, because that structural imbalance remains next year as well. We are not solving the structural problem by cutting programs back. We're just finding one-time money or so to backfill it so that we have to go over this painful thing next year as well. It would be our recommendation, take care of the pain. Nobody wants these cuts, but the more you present an imbalanced equation to the voters, the more likely you are to be looking at all cuts instead of half cuts. So that's just my counsel for this time. The voters will probably ultimately have their say in that, but I'm just telling you from what I hear in my community, what I see in polling, the farther you get away from that balanced approach, and this is clearly going the opposite direction, the more difficult you're going to have to be back here in July making those very difficult cuts that are on top of these that you're unwilling to make today.
Well, first of all, I'm greatly encouraged that voters are going to have a say in this.
I said may.
And beyond that, when we get through all of this, we're going to be sustaining 90%, if not more, of the governor's cuts. And, as you will see in the next few days, we will be proposing cutting into some programs that the governor has not. So it is not all one-time money.
Yeah, probably.
So with regard to the durable medical equipment, did we take that vote yet? We already have the motion. And is that without objection? I believe so.
Which one are we on?
Oh,
On this one.
we're rejecting, so you're going to be a no on this. So then where are we at? 10-5 or 10-4? We're 10-4. Okay. Sorry about that. 11-4. All right. Glad someone's counting. Page 14, folks, establishing maximum annual dollar limits for medical supplies. Mr. Douglas.
Yes, similar to durable medical equipment, the administration is proposing caps on various medical supplies, including wound care, incontinence, urological catheters. These will again cover 90% of the population. Beneficiaries, adult beneficiaries, won't be impacted. The top 10% will.
To save $1.9 million, we're going to cap items such as wound care dressings, incontinence supplies, urologicals, including catheters and others. I know this brings you no great pleasure to even propose to us. Senator.
The recommendation from the subcommittee is to reject this proposal.
And so the motion is to sustain the subcommittee's rejection, and the vote is 11-4. Page 15 establishes maximum annual dollar limits for hearing aid expenditures.
Again, similar to the other two, it would set a cap for hearing aids, set at $1,510 annually for adult beneficiaries only.
Very good.
I would move that we accept this placeholder.
Okay. Motion is to approve with trailer bill language without exception. 15-0. Page 16. This has to do with Proposition 10, first 5, for Medi-Cal for Children.
Yep, Teresa Calvert with Department of Finance. The administration's proposal is to have an ongoing redirection of Proposition 10 funds. In 2011-12 budget year, the proposal is to redirect $1 billion from state and local commission fund balances. The ongoing redirection beginning in 2012-13 would be a redirection of 50% of the revenues that would otherwise flow to the local and state funds. This proposal will have to go to the voters for approval as it changes the purpose of these funds that were approved in 1998.
So of this $1 billion, $950 million is coming from the local commissions, $50 million from the state commission.
That is correct.
Much debated subject under this dome, something that the voters have seen many times, so not a new issue for anybody. Are there any comments or questions from the committee? I believe that we're suggesting a bit of a compromise position, which would be to score the $1 billion for the budget year, but that in the out years we would not interfere with the revenue streams for the purposes of the First Five program.
So moved.
And that was the decision of the subcommittee.
Could you restate that again?
Sure. It's to score the $1 billion, but then for just the 11-12 year, but to deny the 50% ongoing transfer.
Yeah, this will work together on that as well.
That'll be 11-4. And page 17 is trailer bill language, Medi-Cal rates for Lanterman managed care clients.
Consistent with the transition of consumers from the Lanterman Center back into the community, we are working with our managed care plans to ensure that the consumers are enrolled in managed care plans and receive coordinated medical care. We therefore need to develop special capitated rates for this population. We are requesting trailer bill language that authorizes us to develop these rates. It will be consistent with how we currently develop the rates for our Ag News consumers, and it will just expand it to the Latterman consumers as well.
Very good. And the stakeholders have not expressed any concerns?
We haven't heard any concerns from this.
Very good.
Motions to approve with the placeholder language.
Very good. Without objection? Without objection. Page 18 is, again, trailer bill language with some savings approaching $12 million Medi-Cal eligibility processing by the counties.
Over the last several years, the legislature and the previous administration had not provided counties with a cost of living adjustment. And as part of the proposed budget, the governor is proposing to continue to eliminate the cost of living adjustment, and this requires a change in the statute to eliminate this COLA, and we're requesting the trailer bill to make that.
And that has been the case since 2007?
That is correct.
All right. Without objection? Page 19 is a technical issue regarding working disabled program change.
That's correct. This is a technical issue. A couple years ago, the legislature passed legislation to ensure that more individuals could take advantage of the Working Disabled program. This is a program that allows individuals with disabilities to attain employment but still receive health coverage. The changes that we made, though, also we're going to try to change the premium structure, but given the rules under both the American Recovery and Reinvestment Act as well as the Affordable Care Act, we would be out of compliance with the eligibility maintenance of effort requirements. So we're requesting to eliminate to hold off on the premium changes until such time that we are not out of compliance with the maintenance of effort.
Very good. We have a motion by Senator DeSaulnier, and without objection, that will be the order of the committee. Mr. Douglas, thank you very much.
Thank you, as always.
Appreciate your help.
Okay, thanks.
So we'll be moving on to page 20, which is Mr. Mibb, Managed Risk Medical Insurance Board. Welcome. Good afternoon. Mr. Mibb.
Yes, thank you. Mr. Chair, committee members, Jeanette Casillas, Executive Director of the Managed Risk Medical Insurance Board, here to present the budget reduction proposals before you. The first one here on page 20 is the proposal to increase our Healthy Families premiums for our higher income population, individuals with an income between 151 and 200% of poverty would have an increase of $14 per child for a total of $30 a child. The highest income category of 201 to 250% of poverty would have an $18 increase per child for a total of $42 per child. This proposal has a general fund savings of $22.2 million, and this is associated with the premium increase.
And unlike some of the other measures with the Department of Healthcare Services, no need for federal waiver, but we just need to amend the state plan?
We need to amend the state plan and demonstrate to them that we are still within the 5% overall threshold, which we believe we are. At this point, with these increases, we are at about on an average of 4%.
And where are we now? Prior to this proposal?
I think we're at 3%.
Very good. Thank you.
Move the proposal with placeholder language to achieve the savings.
All right. Without objection. And the next issue is a conforming issue?
Yes, it is. It's the conforming issue to the proposal in the Medi-Cal program to increase our copays in the emergency room. We already have a copay of $15. This is to increase it to $50, conforming to Medi-Cal, as well as the inpatient hospitalization copay of $100 a day, two-day minimum or two-day maximum. Excuse me.
And again, waivers needed for this one.
I'm sorry?
A federal waiver would be needed for this.
This, again, what happens in the Healthy Families program is we actually have statute and regulations that address in our health plans the maximum copays that we can charge in a benefit year, which is $250 per family. So it doesn't do anything to that 5% threshold. It just gets the family to the max sooner. If they hit the max, then there's no copays for any other services for any family members for the remaining benefit year.
Very good.
Motion to approve the proposal with placeholder language.
So the motion is to approve without objection. We're on page 22, talking about the elimination of vision coverage.
Yes, that has a savings of $11.3 million general fund, and that is to eliminate our vision coverage completely through our vision plans as we currently have it.
So this is annual eye exams and glasses for children.
Yes, frames, lenses, eye exam.
I have such a clear memory of my own experience in the 4th grade. I was a really good student until the 3rd grade. Suddenly, I couldn't see. Fortunate for me, I got to see an eye doctor, and they put glasses on me, and I could see again. It was like magic. And I could see the blackboard again, and I'm here today to talk about it.
Okay.
This is a tough one. I know you're trying to do your best here.
Having said all that, Mr. Chairman, I agree with you, but the motion is to approve the recommendation.
The subcommittee's recommendation, which the motion...
I'm sorry. I'm sorry. I got ahead of myself.
Yeah.
Thank you, Diane. I was just so moved by the chairman's comment. The committee's recommendation is to reject the governor's proposal and to eliminate instead and reduce by $3 million in general fund by implementing cost containment for glasses and lenses and provide placeholder trailer bill language.
Okay.
So we'll reduce the savings from $11.3 million to $3 million, and this would sustain the subcommittee's decision. And
Mr. Chairman?
Senator Huff.
Yeah, on that point, my understanding is these were not voted on in subcommittee, and yet there's a subcommittee recommendation.
Well, to be more specific, and thank you, I stand corrected. In some cases, there have been some votes in subcommittees, in most cases not. So these are recommendations.
And where were those recommendations formulated?
These are staff recommendations.
So it would be helpful, because it wasn't reflected in anything that we have, that you have Democrat recommendation, and then we can, part of our shock over here is we thought you were coming in here prepared to vote on the governor's cuts, because that's all we have heard, and we've been through the committee hearings and stuff. And so it'd just be helpful to us if there is a different direction that you at least give us a heads up on.
Of course.
That. Thank you very much. And we would disagree with the motion.
Okay. And Senator Wolk is out of the room, so you've got that accounted for? All right. Senator Fuller.
Well, I'm sure that everyone's just as agonized as I am, so please forgive my comments. But I would like to know the total percentage of cuts that we have failed to approve at this time. $216 million out of approximately. Out of 800,000. And we failed to cut two.
No, we cut
2.6. Okay. It's just that my concern is that none of us want to do this. We're all here trying to make a good bipartisan effort. And now on our side, we're surprised because no positions were recommended to us. So we're beginning to feel extremely uncomfortable, but we want to help fix the budget problem. So if there's going to be a tremendous amount more of rejections of the governor's proposal, I think we might want to caucus and talk about this or something. So just bear that in mind, because we are at the point where none of us want to do this, but a good bipartisan effort would require good information sharing for us to be in a comfortable place when we begin. Thank you.
Sure. For lack of communication, you have my sincere apology. With regard to the deliberations on Medi-Cal and Healthy Families, out of $1.7 billion worth of proposed cuts, we will be rejecting approximately 10% or $200 million, a little more than 10%. So that's what we're doing. And again, it will be made up with other solutions, in many cases, cuts to programs that the governor did not propose, ongoing cuts. Others will be made up, possibly, depending upon what final decisions are, with some of this savings that have been identified by staff that the administration did not recognize. And again, there's always a revenue side to the equation as well. So we all have opportunities to be following the path of these very unpleasant cuts or trying to soften some of the hardest edges. And that's what that 200 out of the 1.7 billion would represent from our perspective.
And if I may?
Of course.
It is not the softening that troubles me. It is the fact that I will have gone up on X number more cuts than you and have no idea what our other solution is ahead of time when I'm trying to be bipartisan and in unison. And so I'm just troubled. We'll try to get through this, but I think you can see my dilemma. I don't think anybody wants to do the things that we're doing. But if I'm going to do them, I want to know what the plan is before I commit to it. And that's all. Thank you.
All right.
Senator Lynn, can I just clarify the last?
Senator Lynn.
Thank you. The last recommendation here, it's rejecting the governor's proposal to eliminate and instead reduce by $3 million, correct?
The governor's proposal was to reduce by $11.3 million, and the motion is to reduce that savings to $3 million.
To $3 million. So it's not 0.8, not 8.3. It's 2, 3.
Have I got it wrong?
Well, you are
Rejecting the governor's elimination.
Right, and instead, right. We're doing cost containment of $3 million, so it's not the 8.3, it is a savings of $3 million.
Just a savings of $3 million.
Right.
Okay, thank you.
Sure.
Mr. Chairman.
Senator DeSaulnier.
I just want to thank our staff. I know this is the first of many of these, but for Budget Sub 3, and I want to acknowledge Senator Alquist and Senator Emerson, who went through many hours at Sub 3 of these hearings, and also acknowledge, I apologize if I misrepresented, because I know Dr. Emerson was there, and a lot of these expressions on the changes he did not express at the Budget Subcommittee. But thank you.
Senator Evans.
Thanks, Senator Leno. I have to confess I'm getting a little confused by some of the discussion because this is the first of several hearings I believe that this entire committee is going to have to go through a lot of the work that the subcommittees have done. And, I mean, we're not doing what we're doing today in a vacuum, correct? I am assuming we're going to look at more cuts, some more rejections, and the question I have is, well, first of all, I don't believe the subcommittee work is completely finished yet, is it? Yes. It is done? Okay. But correct me if I'm wrong, in subcommittees we did have opportunities to talk about different ideas and proposals and suggestions and offsets and cuts and revenue ideas and things like that. And I'm assuming that we will have the same opportunity to do that in the larger committee as well. So if there are additional ideas or thoughts or recommendations that folks have, whether from whatever caucus, I would imagine that we could entertain those. So I'm getting a little confused by, I mean, I know we're keeping kind of a running tally of the cuts we've taken and perhaps some of the offsets that still need to be made, but we're not done right now. We're having another hearing tomorrow, I believe, and Friday.
And Friday as well, correct.
Yeah, so, and then there's conference committee, and so this is not the last word here. I'm listening to the conversation as if it's happening in a vacuum and feeling like, you know, this isn't just the whole picture right this moment. We're dealing with some smaller problems within the larger context.
Points well taken. Thank you, Senator Evans. Senator Huff.
Yeah, Senator Evans, in response to your question, we do feel like it's in a vacuum because we participated in the subcommittees. There was no direction given, no votes taken there. We have no direction here. So you may not be in a vacuum, but we are. That's our perspective. We were also admonished by the chair when we began that if we identified cuts, we identify offsetting revenues. We're not seeing that full picture. You may have it. We'd love to know what these stimulating, revenues are or cost shifts. It is unfolding. But in the absence of us knowing the end game that you all seem to know, we're making cuts on difficult things we don't want to make either, but we're supporting the governor because he's the only one that's given us a balanced plan so far. Yours is not balanced that we can see because we're only getting it page by page as we flip through and we find out that there is a recommendation we don't know about, and I've already discussed that with you. But to your question, that's why it is perceived as a vacuum by our part. We're having to make decisions in a vacuum. We are in a vacuum.
I thought we were working our way through that. That's what confuses me. I mean,
but clearly somebody has defined an end game that is 10% cuts with 10% cuts in other areas. But we don't know whether those are better or not. And when you impact one side of the ledger, you're affecting the other side of the ledger. And we're being asked to vote on this right now without knowing what this is. That's the problem. Fair enough?
Well, I disagree, but I mean, I've served on only one subcommittee. I haven't seen the work of all the other subcommittees, and that's why I thought we were getting together is to work our way through all that.
And we're hearing that there is a recommendation from the subcommittee that our members know nothing about.
Well, that I can't speak to. I hadn't heard about that.
That's the vacuum.
But I mean, the overall, I thought that the purpose of the larger committee was to work our way as a committee through what the subcommittees did. Because I'm on one subcommittee, haven't seen what the other subcommittees have done, but this is the opportunity to do that now.
Let me put it another way. We have been told we need Republican votes to put this budget on the ballot for the people to decide.
Right.
And yet we are kept in the dark, and we are asked to trust them. They're not following the governor's plan. We don't see the plan, and yet we're supposed to go along. And to us, it looks like it's going more imbalanced or more in a direction that are less likely for our members to go up than more likely. So we're not sure you're really getting to where you want, but we're not a part of that discussion at any level, evidently. So we shall remain here and, make our little snarky comments as necessary. But we just wanted to register that it's frustrating. We want to have more information ourselves.
Well, and I'll just share a level of frustration. I think all of us are frustrated with the whole situation. And this is not our first year at this. This is at least the third year that we have had and sustained these very, very difficult cuts. And I'm glad to have this more bipartisan discussion and even, the airing of grievances, such as they are. I think that's a healthy debate to have and a healthy conversation to have. I do think, though, we have to have a level of working through the whole process together to get to the end. And that's, in my opinion, what this is. I have not seen a whole plan. I'm operating with a level of trust here as well and making some very, very difficult decisions. And I just have to say, and the chair says without objection, I have an objection to every single one of these, and I don't think I'm the only one here. So this is difficult for all of us.
We will get around to everybody's comments. Senator Huff, I just want to, again, to the degree that there was any surprise element in that which has transpired today, I've already said it once, I'll say it again, I'm sorry for that. But let's be forthright here. Unlike every one of my Democratic colleagues sitting on this panel, every one of my Republican colleagues have signed pledge saying they will never vote for a tax. So it's second-grade math, balancing this budget. It's addition and subtraction. You've already taken addition off the table, so it's actually a given that you're going to accept every one of the governor's cuts. So it's not a surprise. You may not like it. I know you don't like it. I know I don't like it. But because we are not signing pledges, taking either addition or subtraction off the table, are here to massage this and see how we can soften some of the edges. You don't have that option because you abrogated that opportunity before you even got here. And that's a given. And we can be forthright about that. Senator Huff, before Senator Simitian's ahead of you. Go ahead.
Mr. Chairman, I apologize for coming in late. I was visiting with some folks from a redevelopment agency in my district who wanted a chance to chat with me.
You may want to go back.
Well, I really, each of us will have our own perspective, but I'd like to respectfully suggest, and I'm sorry, I don't mean to be presumptuous, but let's all take a deep breath and calm down. This is hard for everybody. I can't speak for what happened in the other budget subcommittees. I know in the budget subcommittee, which I'm privileged to chair, Mr. Lowenthal is the second Democratic member, Ms. Fuller is the Republican member. They'll both vouch, long hearings, a lot of debate. Everything was sunshined. Some of our votes were unanimous. Some of them weren't. Questions got asked and answered. I think the process worked just fine. The difficulty, of course, is that we're being asked to make decisions at a more rapid rate involving more dollars than ever before in the modern history of the state. That means that after we thought we came to some conclusions in the budget subcommittees, that there was more work to be done. Understandably, not everybody was unanimously enthusiastic about the work product of the budget subcommittees. Also, new information came forward. So the full committee is here to have those discussions today. Some of the information we'll be talking about is new information, not just to our Republican colleagues, but to Democratic colleagues. And new information is going to surface after things leave this full committee and when it goes to the conference committee, and we'll be asking questions then. I understand that colleagues who are trying to figure out, as Mr. Wright said only recently, compared to what, are going to be struggling to say, I don't know where this fits into the larger picture if I don't know what the larger picture is. But I don't think that's unique to any one party. So we did the best we could in our budget subcommittees. We made tentative decisions there that will or won't stand as they go through the process. I think we all understood that. There's some new information that's going to come out in this full committee to the extent that folks can be patient with one another about putting new proposals on the table. I think that's helpful. But I think both sides, frankly, should have a little more trust in one another that we're trying to wrestle through what is difficult for all of us. And I'm disappointed that the healthy bipartisan tone we struck in our subcommittee seems to be evaporating quickly here in the full committee, and I'd like to urge us to see if we can't wrestle it back.
Well stated, Senator Smitty. And Senator Huff, followed by Senator DeSaulnier.
Yeah, and to the chair's comment that we've taken pledges not to raise taxes, so all we can do is support the governor's cuts. That doesn't mean, given our own budget, we would be doing the same cuts. You know, you have decided that you have other cuts you would like to make in shifting. We're doing it because at the end of the day, we're the minority, and we recognize that, you know, you'll have your way. But to the degree that you were hoping there would be some Republicans who would make that difficult decision and go against a pledge that they made, you're going in the wrong direction. You're making it, if it was a big pill to swallow before, it's becoming a gigantic pill. So I'm just offering friendly advice that it may make your members feel better, but you're going farther from where you need to be. And so I would suggest you counsel with your governor and try to find that even $12.5 billion cuts you and the pro tem talked about on the floor the other day, instead of $8 billion less $200 million that we've identified now in earlier action. And, you know, that's all I'm trying to say. And I am listening to Senator Simidian, and I'll keep my mouth shut for a while.
All right. And Senator Huff, I do take those as friendly suggestions. I do want to correct, though, that no one is expecting anyone to break that pledge and to vote for a tax. I get that. And that's not a proposal that the governor has stated. The governor, throughout his campaign, consistently said he would not support any taxes not supported by the voters. So he has kept that pledge. No one in this building is talking about anything other than that. So to somehow suggest that anyone is asking anyone to break a pledge is just not so, because voting to let voters speak is not raising a tax. I know Grover Norquist has a different opinion, but he was not elected anywhere in California. So let's just be clear. The proposal is not to ask anyone to vote for a tax. And to the degree, and I'm struggling with this as we work through this, I just don't understand, and I'm open to suggestions to all my colleagues here, because I don't think this is a partisan divide here. This is an organic process. Nothing is decided by the pro tem or the chair of this committee or any other committee. We all have votes, and we don't know how this comes out. So it is a work in progress. I just don't understand the facilitation of having everything revealed and understood at once. We have to take it page by page, step by step. I'm telling you, my commitment to you and publicly is to keep within the governor's proposed framework of a budget, which is approximately, and his numbers are changing too because he just decided not to go through with the sale of state property, so his numbers just adjusted. So within $100 million here or there, out of $85 billion, we're going to see some shifts, but otherwise I and my Democratic colleagues are committed to that number, and I hope you can trust in that. Senator DeSaulnier.
Senator Simidian said everything I was going to say, so with that I would offer my chair as we go to the next part of the agenda to Senator Simidian.
So make sure everyone has said his or her piece. All right. Thank you. Ms. Casillas, thank you very much.
Did we vote on this?
On the elimination of vision coverage, the motion was to reject the governor's proposal. Would you take a vote on that? Not yet. And then rather than take the $11.3 million in savings, the suggestion was that we would score $3 million in savings in cost containment for the glasses and lenses. And I would imagine, are we 11-4 at this point? 11-4. Okay. So that concludes Medi-Cal and Healthy Families. Thank you. As we begin on page 23 and resources, just an announcement to make. Without objection, we're going to take no action on page 23, which has to do with the peer program, and also on page 31, which has to do with the CPUC. This was some recently identified money that was not heard in subcommittee. It was proposed to be addressed today. People have questions, comments, we're happy to have them, but otherwise the proposal is not to take any action today.
Mr. Chairman, just on this point to clarify for members and for members of the public, no action is no action today, or is that no action this week? Just because I suspect that'll be that'll matter to some people. And I think the answer is no action today.
Yes.
So that the subject remains open and could be acted upon in subsequent hearings later this week.
That's correct.
Thank you.
Mr. Chair.
Yes, Senator Wright.
On this matter, when it goes back to subcommittee, several of these programs have in statute requirements that the companies perform a function. If we're going to take the money, then I think we need to put in the trailer bill that the function is also suspended so that we don't take the money and require the agency to perform the function without the money being present.
Exactly the reason why this should be heard in subcommittee.
Okay.
Right. So moving on to page 24. So page 24 is a vote-only item. It's a technical issue dealing with watershed implementation reappropriation. Any comments from the committee before we take that vote?
What's your vote going to be?
The recommended motion here is to deny without prejudice.
And we deny that. We want to deny with prejudice.
Okay. The Assembly denied without prejudice. It would be to conform to their action.
So moved, Mr. Chairman.
And you're not with that yet? Okay, so are we 11-4 still? 9-4, okay. Also vote only item on page 25 dealing with Fire Civil Cost Recovery Program. The Assembly denied this also without prejudice to give it time to give further consideration, and that would be the recommendation.
So moved, Mr. Chairman.
And that would be without objection. Page 26. Engine staffing for CAL FIRE.
Matt Alme, Department of Finance. Part of the governor's budget proposal is a general fund savings of approximately $30 million, reducing CAL FIRE's firefighting from 4 firefighters per engine down to 3, which was the CAL FIRE fire engine staffing prior to 2003. We did a analysis of the effectiveness of initial attack since 2003 and found that it was more or less consistent with historical standards.
Thank you. And there's a $30.7 million savings here.
That is correct.
Very good. Any questions from the committee? Very good. We do have a motion to approve this cut of $30.7 million. Without objection. Page 27 is fire protection permanent funding. Welcome.
Good afternoon. Ken Pimlott, Acting Director, CAL FIRE. Budget change proposal to move a number of items from that have historically been funded either in all or in part out of the emergency fund, move those into the department's base budget. In particular, the aviation management unit, where we maintain and support our aviation program. Historically, almost half of that program was funded from the emergency fund. This would move all of that under base budget, along with the very large air tanker, the support base at Victorville, San Diego Helitac, which is an interagency cooperative agreement with the San Diego Sheriff's Office for a firefighting helicopter. Aviation asset coordinators to support the military assets that the state engages in statewide. 2 fire engines in the Lake Tahoe Basin, defensible space inspection program, and support for CalCard and payment process result from large volume of purchases during fire activity.
Thank you, sir.
And as a point of clarification, this is not actually additional money. This conforms to action by the legislature last year to zero base expenditures that had previously been funded from the E-Fund. So this merely continues CAL FIRE's existing level of expenditures from prior years.
Very good. I believe that this comes from a LAO recommendation. Can you speak to that?
Yes, Leah Moore, LAO. The moving to permit funding was based on our LAO recommendation. Initially, we had no issues with this BCP, but on direction of committee staff, we've identified $9.7 million that could be rejected, including very large air tanker, Victorville Air Attack Base, Defensible Space Program, Lake Tahoe Basin Fire Engine staffing, and 1 position each from Aviation Asset Coordinator and CalCard support because they are lower priority given pressure on the general fund.
Thank you. Senator LaMalfa.
Thank you. I just wanted to seek clarification on this. So the administration does not seek to permanently eliminate the funding or these very key public safety equipment, et cetera?
Yes, that is correct. When we went through the zero-based budget analysis, we looked at we always were cognizant of the fact that you always have to be careful about being penny wise and pound foolish. And so you have to recognize that some reductions to CAL FIRE's initial attack capabilities could end up costing more money on the E-Fund side to the extent that more catastrophic and costly wildfires occur. So we looked at the effectiveness of, say, the 4th firefighter and saw that there didn't appear to be any increase in initial attack effectiveness, but a lot of these aviation asset, those are expenditures that are essentially force multipliers and that improve initial attack. And there's always the risk that to the extent that you make reductions in initial attack, there's a risk that you end up having higher costs through E-Fund. So that's why, from the administration perspective, we weren't comfortable making reductions there.
Thank you.
Thank you, Senator LaMalfa. Senator Simitian, you discussed this in your subcommittee.
Move the recommendation, which is to deny without prejudice. And, Mr. Chairman, a reminder just to clarify an earlier comment that was made. We have finished up our budget subcommittees. That's true for now. So when we say deny without prejudice, it means just that, deny without prejudice, because we're going to have an opportunity to revisit these in the spring. So that's what deny without prejudice means. And obviously, there are a number of areas where we have to take action right now, so we've been trying to take action right now. But in other areas where we think more information will be helpful and the delay doesn't cause us a problem looking forward, that's why we've often got a deny without prejudice recommendation, and that's what it means. Move the recommendation.
As a point of clarification, I understand, is the recommendation based on the LAO discussion of the 9.7? Is that deny without prejudice 9.7 or the 3.5 in the agenda? I didn't understand the...
I'll let Senator Simitian explain his own motion, but I understand it to be the denial of the $42.7 million.
I see. Okay, deny without prejudice the entire 42. As one point of concern, maybe CAL FIRE can speak to this. I think that was an action that the Assembly was trying to go in their subcommittee hearing, and one of the risks there is that this is CAL FIRE's baseline budget, and the risk is if the funds aren't built into the budget, in the early budget, if there aren't authorized appropriations going through the summer and there's a delayed budget process, CAL FIRE would be in an awkward predicament where they wouldn't have in their authorized appropriation money for these activities.
Understood. But keep in mind that our March action will not be passing a budget, so we still will have the springtime as we approach our June 15th deadline to consider whether or not to put this into the baseline budget.
Understood. Thank you.
All right. Yes, Senator Lowenthal.
I'm just trying to understand what this action really means. When we deny without prejudice, as Senator Simitian says, that provides us with the opportunity to later on to bring this item up. Does that infer that we will not be counting this item towards the $12.5 billion right now? We might bring it up, but it does not count in that.
We're denying that savings, that cut. But without prejudice.
Without prejudice, it can be. We can bring it up at any time from now on.
Yes.
But most likely, it will be. Well, I shouldn't say most likely. It can be brought up from any time. But right now, it is not counted in that.
That's correct.
Balance sheet of $12.5 billion. Thank you.
All right. Senator Huff.
And to the degree that you're basically not cutting the money the governor has with no replacement ideas at this point, we Republicans, again, will be backing the governor's cuts and not going with the motion.
Understood. So that will be, are we back at 11-4? I believe so. Page 28.
I voted to take
Thank you.
In committee.
It's another vote-only item. This has to do with vehicle fleet retrofit at the Department of Parks and Recreation. Finance, you want to go ahead? Or? This is going to be, sorry, vote only. We're just going to take a vote here. Sorry. So this is a conforming item, colleagues. The Assembly denied this without prejudice, allowed them more time to further review, and the recommendation is to adopt the Assembly denial without prejudice.
For that reason, Mr. Chairman, move the recommendation, which is to adopt the Assembly version to deny without prejudice.
Correct. And that is without objection.
No.
Sorry, that's right. Senator Rubio.
Thank you very much. We're on the vehicle fleet retrofit, correct?
That is correct.
Good. I have a question for perhaps Senate budget staff. I'd like, while this is being held until in the spring, could we have a total number of fleet retrofits that are occurring to meet the older vehicle Air Resources Board regulation? If it's just $1.8 million in Parks and Rec, considering all the deep cuts that we are taking, I'll actually vote no on this. I think we should cut the $1.8 million and hold off the retrofits if we're making deep cuts in other places to try to find.
So I understand your concern, and the motion is to deny this expenditure of $1.8 million. So we're not going to spend it. We're not going to. But we will consider this later in the spring, again, without prejudice. So a vote for this is just to deny the expenditure that the governor has proposed.
Okay. Thank you very much.
You bet. Yes, Senator Lamalfa.
On these vehicles, do we have some kind of inventory of how old the vehicles are affected by this? I mean, it says 1960 to 2006. How many of them are at what age on the spectrum here? So we know what we're retrofitting here. I know it's a smaller expenditure, but and how many miles? Like, they might have a 1965 Dodge or something here that only gets driven 500 miles a year for very specialized needs. Does that really need to be retrofitted? Questions like that.
Good question.
Senator Muffin, Mr. Chairman, Michael Harris, Acting Chief Deputy Director at California State Parks. We do have that information. You'll forgive me, I don't have it at the top of my head.
Well, I don't expect it here today, but
it is available in the budget change proposal we submitted to the legislature, and we'll follow up with your office on that.
Category of vehicles of a certain age, miles driven, and we may not need to do any of this really on a cost-effective basis for very, very low mileage vehicles. We go through that same debate on our farm equipment, et cetera. So thank you
to
for that.
point out, in terms of the actual request before you, we have 22 vehicles that are so old and outmoded that they cannot be retrofitted. This BCP is actually asking for funding to replace those vehicles.
So still, do we need to be replacing vehicles like that? We would need to know is the specific use for a parked vehicle like that to go pull a dock out of the lake in the fall and put it back in the lake in the spring, like one-time uses. That's the kind of stuff we need to know, because does it make sense? And thank you.
Thank you, Senator Moffa. So you were okay with that one? Okay. So that moves forward without objection. Page 29.
Yeah, but we're sending a message.
Thank you, Mr. O'Hara.
This is not based upon
Department of Food and Agriculture. Also a vote-only item. Senator Simidian, I understand we have an update from the Governor's office regarding this question of 1.6 million.
Yes, Mr. Chairman, the recommendation is to add to the Senate budget bill language a further reduction of $1.6 million, which would be scored in the action in addition to the action that the Senate Budget Subcommittee already took for $15 million reduction. That'll conform to the Assembly. That's my understanding.
And, okay, all right, very good.
And the goal here is to simply conform with the folks over at the Assembly.
All right. Yes. That will move forward without objection. Page 30 addresses California's fairs.
How's that? I'm Rebecca Desmond, the Acting Director of the Division of Affairs for the Department of Food and Agriculture. And the Governor's budget proposes to permanently remove the $32 million of local assistance to county fairs in the state of California.
Very good. I think this was an LAO recommendation. What have you got to share with us?
We recommend that you adopt the governor's proposal and reduce the general fund expenditures by $32 million. Russia Chavez with the Legislative Analyst's Office.
Thank you very much. Questions, comments from the committee?
Yes.
Yes. Senator Huff.
Yeah, Mr. Chair, this is an area that does cause some concern for our committee members, and evidently there's issues that are causing concern for your members as well, because we're denying without prejudice some of these actions and putting it off. So I would just recommend that we do a roll call vote on this one.
All right, so we have a motion.
Mr. Chairman, the motion is to approve. If I could speak briefly to the motion, please. We actually, in the Budget Subcommittee, did not take action on this. We encouraged folks from the fairs to keep working with the committee staff and the administration to see if there wasn't a way to mitigate the damage. Thus far, in the relatively short period of time that's passed, that has not been the case. So the motion to approve is one that comes with a request and admonition that I hope people will keep talking, but mindful of our budget calendar and the need to take action today. That's why the motion to approve is there. My hope is that people will keep talking and find a way to, if not eliminate, at least mitigate some of the damage, because I think all of the committee members, and it's rare that I'll speak for all the committee members, were persuaded of the importance of these tools in local communities. Just a question of where we are in the finances. So move approval and encourage people to keep talking.
So the motion then is to accept this $32 million savings as proposed by the administration. And roll call? We'll call the roll on this.
Leno.
Aye.
Huff.
Aye.
Alquist.
Aye.
Anderson. DeSaulnier.
Aye.
Emerson. Evans. Fuller. Hancock.
Aye.
LaMalfa. Lou. Lowenthal.
Aye.
Rubio.
Aye.
Semidian.
Aye.
Woke. Wright.
Aye.
10-0.
Motion is approved. Thank you, Ms. Desmond. Page 31, as had earlier been mentioned, we will take no action.
Take no action.
Moving on to transportation. Page 32, California Department of Transportation. Welcome. Good afternoon.
Good afternoon. Mark Monroe, Department of Finance. On page 32 here, we have the weight fee swap proposal. As part of the 2010 Budget Act, we had provided for about $1.7 billion in benefit to the general fund through swapping sales tax on fuel for gasoline for the sales tax or for the excise tax on gasoline, and then using a portion of that for general fund. Proposition 22 made part of that, made most of that. Not permissible anymore. And so the proposal you have here through our trailer bill provides for making up most of that. So we would end up with a total of $1.6 billion in general fund relief in 10-11 and $988 million in 11-12.
And specifically, this would conform to Props 22 and 26.
Correct.
Very good. And LAO, I believe you had a thought or two on this.
Jessica DiGiambattista with the Analyst's Office. In addition to supporting the governor's proposal and concept to reenact the fuel tax swap and to recapture the general fund benefit, we would note that there's options to maximize the general fund relief from the governor's approach. Essentially, there's $190 to $194 million in weight fee revenues in between the current year and budget year that the governor does not propose to use all of those for general fund relief, and we think that you could get more general fund relief by borrowing those funds.
Thank you very much. Senator Semidian, thoughts?
Move the recommendation, which is to both approve the governor's proposal as well as borrow the $150 million per the LAO's recommendation.
So that is the motion. Senator Huff?
Yeah, we believe this money can be programmed to fix roads, and so we would disagree with that extra borrowing from the fund.
Okay.
And I'm sorry, Senator, we would just note that we're opposed to any further borrowing beyond the $44 million.
Understood. Thank you. So I believe that would take us to Senator Semidian.
The swap of this in sales excise, but when we did to the weight fees instead of the excise tax.
Mr. Chairman, I'm wondering if to give all members an opportunity to vote on the items separately, we might split the measure so that we had first to vote on whether or not we approve the governor's proposal and then vote separately on the $150 million recommendation.
Right. Makes good sense. So everyone understand what we're doing here? So the initial...
Splitting the motion.
Right.
So to clarify, the new motion then, without objection, Mr. Chairman, would be to approve the governor's proposal and then with your permission, sir, I will make a subsequent motion on the remaining 150, and that way members can vote their best judgment on each of these two items.
So the first motion is then to
approve the governor's proposal,
which is the truck weight fees swap. So that's without objection.
And then the second measure, Mr. Chairman, would be to borrow the remaining $150 million per the LAO's option. So move.
And that would be 11-4.
Thank you, Mr. Chairman.
Thank you, Senator Semidian. Page 33. This has to do with project initiation documents, or PIDs.
Yes, correct. We are proposing an increase of 22 positions for the development of these project initiation documents. They give both the state and locals information regarding the potential cost and scope and scheduling of projects that they're considering doing. And we are proposing that 77 of these positions, $8.7 million, be reimbursed by locals.
I understand we're expecting a report in April. We'll shed a little more light on this.
Yes.
That is correct. That's coming from you?
Eric Thronson with the LAO. That's the supplemental reporting language is required in the report from Caltrans.
All right. So the idea here is that we'll have a little bit more information come the spring. So motion is going to be?
To reject the budget request without prejudice.
So that we can benefit from the information ahead and consider it at that time. Senator Huff.
Yeah, Mr. Chairman, we can't go along with that until we have an implementation plan available, so we would not support the motion.
Okay, so it's 11.
Could I ask a question of Mr. Huff?
Senator Simity, of course.
And Mr. Huff, the governor is proposing to increase workload. So we're rejecting an increase in expenditure without prejudice.
Without prejudice.
And I'm trying to. Usually you like these, I think. So I'm just trying to understand.
So you're going to hold it open.
That's correct.
We're going to deny it for now, with the understanding that we would hear the matter in the spring without prejudice. And essentially, what we're saying at the committee level, which I think is consistent with the concern you just expressed, I may have misunderstood, is we're not persuaded yet. We'll keep an open mind. You'll get another shot come spring to make.
In the spring, we'll have the implementation plan,
and then we'll have the data, and then we'll decide.
All right, we would support that.
Okay,
Thank you.
So that is without objection. Thank you, Senator Simitian. So page 34, high-speed rail.
Who? Republicans? I don't know. You're right.
Who's going to jump in?
The reporting language?
LAO.
Yes. The Assembly proposed and approved the recommendation for budget bill language that would require the high-speed rail and Caltrans to provide a report by May 1st on opportunities that would use existing state resources and how we could use existing state resources and staff instead of consultants to do some of the system development for the high-speed rail.
Very good. So,
Mr. Chairman, there was language that came out of our budget subcommittee that was agreed to by the Assembly as well. So there's conformity on that set of issues. The issue before the committee today is that they produced some additional budget bill language, and that is the language that is before the committee. And so my motion is to approve the Assembly's budget bill language. Then we will be in conformity on all fronts.
thank you, Senator Simitian. Just to share that language, the Department of Finance, High-Speed Rail Authority, and Caltrans shall jointly report to the Joint Legislative Budget Committee and relevant members and committees of the legislature by May 1st, 2011 on whether there are opportunities to use existing state resources and staff rather than contracting out to advance the high-speed rail system development. So that is the budget bill language. Senator Huff.
Yes, I would have some serious concern with this. The high-speed rail already has some significant struggles. The Reason Foundation did a study that found that contracting out saves 20 to 50%. And so if we're going the opposite direction and we're taking our state jobs and backfilling that, we're going to pump up the overhead, not achieve the efficiencies we need to with such a big project. We would definitely be against that proposal.
But that's exactly the point of the report. Is that correct, Elio, to make that determination?
The report is just to discuss opportunities in which you could use state resources and staff to realize efficiencies. So it is only a report. It is definitely not going to have recommendations tied to it.
Mr. Huff.
Could I suggest that there be a report with how high-speed rail could partner more with the private sector, too, to balance that?
I can report that the High-Speed Rail Authority has a contract for management of $199 million, a subsequent contract for $8 million to provide the project oversight to the consulting firm that is doing the management work, and a subsequent contract for $9 million for public relations in connection with the expenditure of the $8 million and the $199 million contract. The High-Speed Rail Authority makes the case that they are understaffed as an entity, and I'm actually, I want to be clear on this, sympathetic with that expression of concern on their part. The challenge is whether or not you can do a $43 billion transportation mega project with consultants as the primary force without the oversight of staff. Now, we've dealt with that to some extent, and Ms. Fuller, you'll recall these conversations, by dealing with the issue of exempt positions at the High-Speed Rail Authority per se. But what our friends in the Assembly are asking us to do is take a look at whether there is unused existing capacity at Caltrans that might be put to use on some of this work rather than incurring additional expense. But right now, for all intents and purposes, 99% of the project is coming out of consultant contracts, and that's got some span of control and oversight issues, as well as a question about whether or not we're underutilizing existing staff. Again, it's only a report. I wouldn't prejudge what the report's going to tell us, and this is a request from the Assembly.
Our nonpartisan independent legislative analyst office could confirm the comments of Senator Simitian. Yes, it is correct. Thank you very much.
That was very nonpartisan independent of you. I appreciate it.
No.
Senator Huff, another comment?
We're looking for a candidate. We got a project.
I was just going to say that California spends, as I recall the data, almost $100,000 per mile in roads constructed in overhead, as opposed to $10,000 per mile in less than $10,000 in other states. So I trust the LAO will follow their honed image of being nonpartisan this and look for the accurate data.
So, without objection? Or with objection? 11-4.
Thank you, Mr. Chairman.
Thank you, Senator Simitian.
This mine are going to go by fast.
So, colleagues, we're doing pretty well. Just have a few pages here to conclude. Page 35 deals with the California Science Center.
Great.
Rod, you need to take a walk.
This is Rod Wright's since 1968.
Good afternoon.
Good afternoon. Kristen Shelton, Department of Finance. The subcommittee rejected the governor's unallocated reduction to the California Science Center and instead adopted a series of changes, including a smaller reduction, which is a $2 million erosion to the governor's proposal. Compared to the governor's budget, which would allow the Science Center to limit its reliance on general fund resources, it's not a core function of government, and we would urge the committee to revisit the prior actions.
Very good. LAO, any comments on this?
Russia Chavez of the Legislative Analyst Office, we recommend that you guys adopt the governor's proposal to reduce the general fund expenditures by $3.6 million.
Very good. The recommendation here, of course, from Department of Finance is to accept the governor's proposal, to accept the action of the subcommittee. And
subcommittee do?
Thereby would put this into conference because the Assembly has taken opposite action. And I think that's appropriate given that 1.7, I think, is certainly a budget issue, whereas the consideration of the exposition park management is other than that, but would allow some further conversation. So, Senator Rubio.
Thank you, Mr. Chairman. We did move at the subcommittee level to decrease the funding for the California Science Center at $1.7 million and working in eliminating potentially the Office of Exposition Park Management. So I would urge the committee to adopt the subcommittee's action so that further discussion is going to be had in the conference committee.
Very good. So that is the motion. So this is to accept the subcommittee's action.
Or reject the trailer bill?
Yeah. All right. So without objection. Page 36 is a, thank you, the vote-only item in the Employment Development Department. Workforce Investment Act funds. This is a technical correction, and the recommendation is to approve the trailer bill language to reestablish the Consolidated Work Program Fund in statute. Any questions?
I'd move on this item.
All right, without objection. And the last item today is the reduction of employee compensation. Core health care plan option.
And things have come down.
Corinne Martone, Department of Finance. We're actually recommending withdrawing our proposal that we had at Jan 10 for the core healthcare plan, and instead proposing a compromise that incorporates CalPERS's concerns with our previous language. And what this would do is we would have one-time savings of $80 million general fund instead of the $72 million, and then we would have trailer bill language that would require CalPERS to either have a core healthcare plan as an option next year or achieve ongoing savings through other operating efficiencies that they can negotiate.
What brought about the change?
Just trying to address CalPERS's concerns with the previous language and the timing.
Senator Rubio?
I want to thank staff for finding an additional $8 million. I'll move on staff's recommendation.
All right, so the motion is to approve not the January, but the February proposal, which consists of modified trailer bill language and new budget bill language, which will achieve $80 million in general fund savings in the budget year and ongoing savings in future years, and technical amendments. All right, without objection.
It's done.
So that concludes our work for the day. Before we adjourn, we have a motion before us. I just want to thank everyone for bearing with us. I think it goes without saying, none of this is easy, none of this is pleasant. And I have high hopes that we'll be able to continue to work together to respectfully be able to air concerns and disagreements and all of that in an agreeable fashion, which I think has been managed today. So I thank my Vice Chair, Senator Huff, all our committee members, and the suggestion has been that rather than convene tomorrow at 9, that we convene at 10, which will allow everyone a little bit longer for briefing. So if that's agreeable, we will see you all at 10 tomorrow morning. Thank you.